Welcome to Insights into Insurance with Tom Sorensen of Americana Insurance Group. All information provided is educational in nature and not intended to be acted upon without first consulting the appropriately licensed professional.
Saturday morning here on KATE, it's Insights into Insurance with Americana Insurance's Tom Sorensen. And Tom, good morning to you.
Hey, good morning, Paul. How are you doing?
Doing great. Shall we get to our listener email?
I am ready.
All right. Hello, Insights into Insurance. I really enjoy your show on Saturday mornings, as I have learned a lot about insurance. I'm over the age of 65. What do I need to do to renew my Medicare supplement insurance this year? Thank you, Barbara.
Well, hey, Barbara, thank you for your email and terrific question. What's great for me and my business is a lot of times when I get questions like this, I got a lot of sources where I can go out and actually find people that know a lot about these topics. So I went out and found my good friend who we've known each other since the early 1990s. Back a long time ago. It's Dave Martins. He's my special guest today, and he's a partner at IFC National Marketing in Fairmont, Minnesota. Good morning, Dave.
Good morning, Tom.
How are you doing?
We're doing good. Yeah, and I guess we can try to answer Barbara's question, but yeah, we have a good business relationship and working relationship with Americana Insurance. They're right there in Albert Lea, and we share different contracts, and glad to be a partner with Tom.
Yeah, IFC is kind of, can you just give me a brief description of what IFC is?
Sure. We don't really do retail like Tom does at Americana. Our clients are insurance agents, so we work with insurance agents and agencies, and we work with about 100 companies that we're their marketing and service arm. So whether it's in the life insurance, long-term care, disability, annuity markets, or health markets like it is today with Barbara's question, we work with insurance agents with all types of different contracts.
And you're our PGA for Blue Cross Blue Shield. Can you just tell, well, I've golfed with you, and you should be on the PGA, but what is a PGA?
Well, a PGA is just called a preferred general agent. There's general agents with Blue Cross and Blue Shield, and then there's just agents that are underneath either general agents or preferred general agents. When Blue Cross and Blue Shield made a business decision here it's about a year ago now,
right,
that they were going to pick 4 preferred general agents in the state of Minnesota, we were picked as one. So we're one of the largest agencies with Blue Cross and Blue Shield in Minnesota.
Correct. And so we work through you as your RPGA for
Correct.
American Insurance. So, well, now let's get to Barbara's question. Dave, what does Barbara need to do for 2018?
First of all, probably don't know enough information. That's why Tom's got a local agent with Suzanne there right at the office. But without knowing information, Barbara, if she's just going to renew her Medicare supplement, she doesn't have to do anything. It will automatically renew.
Okay.
And if she needs to make a change, then she needs to come in and see Suzanne, and Suzanne would look at maybe what type of medication she's on or what changes there might be in her program and see if they need to look at a different product.
Is there dates of open enrollment for that, Dave?
There is. I guess I thought I would do some different things with you today, Tom, to try to go through all the markets. But, yeah, the open enrollment for the seniors, right now we just started October 1st. We just started the marketing where agents can actually start marketing to seniors over age 65. That goes from October 1st to October 14th. And then the enrollment period that everybody has an annual enrollment period runs from October 15th to December 7th. So anybody can switch during that time without underwriting or without anything else. The only other time they can do that is when there's a IEP, which is an initial enrollment period. That's when people turn age 65. They have a period then to go into a product, or when they have a SEP, and that's called a special enrollment period. And that's when they actually have a change where they move, or when they have a change in structure, or somebody retires or changes their job.
Right.
Those are all special enrollment periods.
Okay. So what else should Barbara know about Medicare supplements or people that maybe be looking at Medicare supplements? Is there anything else out there that they should know about?
Yep, there is some things going on. Right now, Minnesota is a little bit of a different state where cost plans have been a huge part of the Minnesota landscape in over age 65 sector. And right now there's about 400,000 seniors that have a cost plan in the state of Minnesota. And that actually has been kicked down the road a couple times where they've extended it. The federal government wants to let it sunset, and they've extended that a few times, but I think we're probably at the end of that extension. So what's going to happen with some folks, if they want to do it in 2017 for a January 1st effective date in 2018, can decide to go to a different product that's not going to sunset. But really the sunset date is until January 1st of 2019. So if there's nothing changed in the senior market, 400,000 seniors are going to have to find a new product in 2018 for a January 1st, 2019 effective date.
So around this time next year, that's when they're going to have to be looking at that.
Correct. In legislation, the companies are still trying to fight it a little bit to try to get another extension, which, like I said, I don't think is going to happen. There is a couple other things being kicked around as far as they've used the grandfathering term, where they'd be able to not sell new products, but be able to continue the products that are sold with that product, and then they would be grandfathered and be able to keep that product. Last but not least is, they're going to have to make a change a year from now if they don't decide to do it sooner.
Okay. Well, I think we got Barbara's question, and again, Barbara, call Suzanne Dixon at our agency if you want to talk more about that. But how about the individual plans, people under age 65? Is there an open enrollment for that?
Yep, there again, there's an open enrollment. It goes from, it depends on if they're going on the exchange, which is MNsure. If they're going on the exchange with MNsure, the open enrollment is from November 1st to January 14th. If they're going off the exchange and buying it through a company, it's November 1st to December 15th. The rates for that were just released this last Monday on October 2nd. Yeah, and there was some change in rates. Everybody that knows unfortunately the individual market has been really unstable. What the government, or I guess the state of Minnesota, came out with last year was a 25% subsidy to knock down rates. We lost that, or we will be losing that now January 1st or December 31st. But the federal government did put in a 15% reinsurance pool. So just in that scenario, companies had to look at, we had 25% out there for the public. Now we have 15, so rates are going to go up a little bit because of that, the 10% difference. But then the rates didn't actually increase as much this year. So I think people looking at the individual market won't see quite as big increase as they have in the past, fortunately.
Well, that's good news. Well, Dave, I believe Paul is telling me that we need to take a break, so we'll be back in 30 seconds. Correct, Paul?
We'll be back with more insights into insurance in just 30 seconds.
Nationwide is on your side. You have a side that is retired, playing tag and getting tired. A side that owns your own store. Looks like you need to explain some more. That's why there's a Nationwide to help protect and grow your many sides. Nationwide is on your side.
Nationwide Mutual Insurance Company and Affiliates, Columbus, Ohio.
For all your many sides, there's Nationwide. Call Americana Insurance Group in Albert Lea and Wells today.
Back here on Insights into Insurance with Americana Insurance's Tom Sorensen. Tom, we've got Dave Martins on the phone from IFC National Marketing in Fairmont talking health insurance. Today we've answered Barbara's question concerning Medicaid supplement insurance and how she needs to renew this upcoming year. Small group always comes to mind, though, right?
Right, and, you always got the Medicare supplement insurance, you always got the individual insurance, and then the other types of insurance is small group and large group. So we'll start with the small group, and basically, what is a small group, Dave?
Well, Tom, a small group is basically a group that's under 50, and that's what determines a small group or a large group, and if it gets right around that number, then you got to make sure that you're talking to an agent and making sure that you're meeting the guidelines by the state of Minnesota. On a small group under 50, they're community rated, so it's not by loss ratio or anything else. And quite a few businesses have small group coverage.
And when you say under 50, just so we make sure that people understand, it's under 50 enrollees or employees, I should say, not age.
Correct. And employees aren't just full-time employees. They use a factor for part-time employees so that if you have maybe three, that people have tried to cheat the system. So if you have maybe 3 part-time people that equal a full-time person, then they also count as an employee.
Okay. Is there any changes or things that you can see coming in the future on the small groups for 2018?
Well, the thing that's changed a lot throughout my career, I've been an insurance agent or in the insurance business for about 29 years, is when I started, it seemed like a lot of individuals were going from individual to small group. And then when there was so many mandates that came on the small group coverage, a lot of small groups broke up and went back to individual. It seems like over the last couple of years, and especially this last January 1st, we put out a lot of small group business because some of the small group business was actually less expensive again than the individual business has been because of the rate increases on the individual side.
Okay.
So that's been one thing that's been going on. It seems like also that the increases haven't been as much as they have been on the individual side because you're spreading the risk more.
Right.
So that's why some businesses are looking at either going back to group or picking up groups that haven't had them in the past.
Now, also, too, as long as we're talking small group, you kind of have like a neat little new announcement about a special thing for a co-op for farmers, correct?
I do. A lot of groups last year came on as owner-only groups, and there were small groups where they maybe just were an owner of a small business or a farmer. Some companies required one employee. Some companies didn't. There was one company that took on quite a few groups and now terminated them all because they changed the rules. So unfortunately, that happens in our industry, but. No, for farmers, we do have something that just came out in Minnesota, and it's called 40 Squared. Okay. And basically what 40 Squared is they put together a co-op. Maybe some farmers remember back in the old days where BMI had a lot of business on the books. They were a milking company that had a co-op put together where farmers could buy insurance, and it's back to that day where the legislation is approved 40 Squared to start a co-op. And I think some farmers should absolutely take a look at that opportunity, and Tom will be getting out more information on how to be able to take a look at that product.
Yeah, we're trying to figure out, because it's so new to us that we're trying to figure out how to get this message out to our farmers and potentially look at this opportunity. So it's been something that my farmers have been asking for years and years and years, and finally we can say, yeah, there is something available out there now. Well, now we're from the small group to the large group, which my guess is if a small group is under 50 employees, large group is over 50 employees. Is that correct?
Absolutely. And the big difference between small group and large group is the way that the rates are determined. The rates on large group are determined by loss ratio. So you have to get some loss ratio numbers if they have a group in place. If they don't have a group in place, they place them into a scale, and then they go by loss ratio after the first year. But mainly most large employers have had a group in place, and those rates are determined by loss ratio. And it's still good to shop it out and make sure that you're getting the most competitive rate out there with the different companies that have it available.
Okay, great. Now, just a question for me. We don't have too much longer here, but dangers of a one-payer system, Dave. Can you kind of tell me what the dangers are?
Yeah, I think I can talk a little bit about that, but the one thing that I didn't talk about on the senior side is the people that are looking at, of course, that have a cost plan. I said there's 400,000 seniors that have a cost plan. The concern I would have is if I decide to switch now and take a different product, if that grandfathering opportunity would come about, then I wouldn't have that opportunity to grandfather, and the cost plan actually is a plan that I would want to keep.
Oh, good point.
So if somebody decides to switch this fall, that could be a mistake if that grandfathering would come to play.
That's a very good point, yes. So
dangers of a one-payer system, I guess I just, you can listen to whatever you want to hear out of overseas in Europe or up north in Canada, and you can listen to one station that'll tell you all the good things about a one-payer system, and you can hear another station or another person talk about all the bad things. I think the bad things would be is it takes away some private enterprise. I think that by all means, I believe that the care would be changed. We have a lot of people out of Canada that come to Minnesota and other northern states because they can get care that they can't get. All of a sudden, you get in line for an operation instead of being able to have the doctor say this needs to be done tomorrow or this needs to be done next week or next month. Sometimes that's not an option on a one-payer system.
Right, yeah. Like you said, there's a lot of, could be pros and cons for it. People need to know and hear those things and maybe research them on their own, too, to just see what it's all about. But in closing, Dave, I just want to let everybody know that they can contact Suzanne Dixon at Americana Insurance, and she's our health insurance associate in our agency. She can be contacted at 507-377-2000. And then our website is americanainsurance.com. And if anybody wants to contact us, they can contact me and submit questions to the show, too, at insights@americanainsurance.com. Dave, I want to say thank you. You were terrific. This is really opens up a lot of people's eyes, I believe, on what's going on in the health insurance world.
You bet, Tom, and we'll get you some more information on that 40 Squared program for farmers.
Perfect. Thank you, Dave.
You've been listening to Insights into Insurance from Americana Insurance Group. All information provided is intended to be educational in nature. Before acting upon any information obtained during the Insights into Insurance radio show broadcast, consult an appropriately licensed professional.